Despite the promise of a coming vaccine, we still have a public health problem on our hands as we enter the second wave of COVID-19. And as a nation, we have no consensus on whether or not to wear a mask. This is Data Skeptic Consensus, the 14th installment in our series about how multi-agent systems achieve collective decision-making. Today on the show, I speak with the authors of the recent paper, Face Off, Polarized Public Opinions on Personal Face Mask Usage During the COVID-19 Pandemic. It's an exploration of Twitter data, sentiment analysis, topic modeling, and insight into what the public thinks and maybe why.
My name is Neil Young. I'm affiliated with, the Department of Computer Science at the University of Rochester, and I'm working towards a BS in computer science with a minor in math and statistics.
I am Jiebo Luo, professor of computer science at the University of Rochester. My research areas are in the general AI and machine learning data mining areas.
I'm Jonathan Lai. I'm a junior at the University of Rochester, majoring in computer science and economics.
Well, great to have all three of you here today. To get started, tell me a little bit about what brought the three of you together.
So computational social science is one of my research areas, and my group has been working on similar topics. So we've done a lot of election-related research. But this year, because of COVID-19, it becomes clear to us that we should seize this opportunity. So as I was teaching the data mining course, I encouraged students to take COVID-19 as a topic for the course project. So Neil and Jonathan are among them. So we investigate a number of issues from face masks, hoarding, panic buying, mental health issues, controversial use of COVID-19 terminologies such as China virus. But face mask is one of the most interesting issues. I'm glad Neil and Jonathan jumped on the opportunity.
Right. So as Professor Luo mentioned, our project originated as a sort of final course project for our data mining class. And then we worked over the summer refining it. And so basically the impetus, for the investigating masks as a specific COVID-19 subtopic was the fact that it was so controversial, I think. And it's very interesting because we just sort of casually, I've noticed that there seems to be cultural differences in how Americans sort of approach mask wearing, and many countries in Asia, for example, approach mask wearing. It's pretty ingrained in the culture. Just wearing a mask, in Asia means most of the time you're not necessarily sick, but you want to prevent someone else from being sick. It seems to be the attitude. But then these sort of attitudes towards masks was polarized and skewed. And then there's increasingly large amount of coverage about mask wearing becoming a political issue, right? We have articles about why will Trump not wear a mask, or certain demographics having different views towards masks. And so with these facts, we thought that it would be a good topic to investigate.
Also, we'd asked from our experiences, we kind of noticed that when it first broke out, we're just wearing masks in general. Everyone just kind of looked at us funny, just to wear masks at the beginning of the pandemic. But, it's kind of just shifted to, everyone kind of wearing masks eventually, and it being mandated for everywhere now.
Well, that's good to hear, given that they definitely help in public health. But I get the sense that that's not a universal thing we can say about everybody everywhere. I guess to get started, maybe you could tell me a little bit about how you collect data in this area. Obviously, there's an interest in making some statements and doing some analysis around the usage and opinions about face masks, but how do you get started tapping into some data source that can give you a real place to start from?
So we choose social media as the source of data. This is different from many other reports which rely on surveys and questionnaires and polls to study public opinion, many issues including face masks. So there are some issues with the traditional approach of using surveys. So number one is scale. So typically a survey or poll only involves 1,000 or fewer people. So scale is an issue. With the small scale came the bias. So we all know that polls were not accurate in predicting the outcomes of presidential elections, at least not the percentages. And also polls and surveys are not necessarily real time because you send them out and people may not respond immediately. They may not respond faithfully. So all these are sort of weaknesses of the traditional approach. So we decided to use social media where we can get lots of data. We can get millions of users and we can get this data on an ongoing basis to perform real-time analysis We believe this approach can overcome a number of weaknesses of the traditional approach.
Yeah, so basically there are some intrinsic issues with survey-based approaches that social media data mining resolves. And now I've received the question before about why we chose Twitter specifically. And that's because Twitter in general, the types of topics and the types of conversation that happen on the platform are typically more serious, right? So like we wouldn't necessarily go to Instagram, namely first because it's a picture-based social media site, while Twitter is mostly text-based. And then previously in the literature, Twitter has been verified as a valuable source of analyzing and predicting various large-scale societal events. So Professor Lo mentioned that his group has worked on sort of elections, for example, the 2016 election, sort of predicting, and I believe the group did a better job when compared to the polls and the actual percentages just by using sort of social media. There's also been previous works looking at the H1N1 pandemic and the Ebola outbreak and in sort of analyzing different aspects of those pandemics. So thought that Twitter would be best. And so originally we combined streaming from a Twitter, basically using certain hashtags like hashtag COVID, hashtag mask, that we basically created a dictionary sort of with these hashtags. And then we also supplemented this very large COVID data set that I believe the University of Georgia released. And then that was basically how we got this sort of data. And Jonathan, maybe you could talk a little bit about like hydration.
Oh yes, Twitter has this thing where like you can't just store all these tweets online. Basically, you kind of have to manually go and just like gather the JSON tweets yourself. So that's kind of what we did. So we kind of just found the JSON representations of like all the tweets from January to August that kind of fit into, like Neil said, like our COVID-19 or face mask kind of a dictionary. And then after that, we just kind of pulled what relevant features we wanted from it, like the user attributes, their name, where they're from, the location, their biography and stuff like that. And then cleaned the tweets for like URLs, hashtags, and emojis, and then like restricted English only. That's kind of how we build our data set just from Twitter.
You'd mentioned some of those components, as maybe we should say in case people don't know, when you post a tweet or when you work with the Twitter API, of course you can look up who tweeted what, but there's a variety of extra metadata that's in there as well, which if populated might tell you something about location and whatnot. But I don't know if it has like gender and ethnicity and those kinds of details. Can you talk a little bit about how you might unlock more interesting or more typical demographic information?
Right. So I think we're all aware at this point that there are severe demographic disparities in how COVID-19 has affected people. And so with this in mind, we found it important to sort of infer the demographics of the Twitter users. Kyle, you mentioned there is metadata within each tweet. So for example, location, if there is location, name, profile picture, but it's very noisy. So for example, I think Jonathan can attest to this. We found most of the tweets, for example, had no location attached to them. They also had, let's say, within the spots for your name, like your first and last name, people would put
fake names,
like many different sort of things. Right? Like Jonathan, like what's an example?
Like best jumper, something like that, something great, like something not even relevant to their names. Yeah.
Yeah, or like swag master, like first name swag, last name master, or something like something silly, where this is not the real name. And so with that in mind, we can't really depend solely on that metadata. And we find it good to sort of supplement that metadata. And so the way we do this is basically we have a bunch of demographics. So in order, we infer age, gender, political affiliation, whether the person is a college student or not, the average household income of their zip code, if there is a location associated with it, and whether they live in a metropolitan or rural area, as well as ethnicity. And so we have a figure in our paper that just shows sort of the inputs and outputs. I don't think we should go over entirely the methodology of every single sort of input output, but maybe we can talk about a few of the interesting ones, like how we determine political affiliation.
Let me just offer information. To infer demographics, we can use machine learning techniques, other data sets that are labeled or with the ground truth information. So we can pre-train these classifiers or predictors and then apply them to any target data set, which is what we have done in this case. So I think a number of them are worth noting, like how do we predict college student political affiliation? So you guys can give some details.
I guess I can talk about age and gender classification. So for this one, we use a model that's been used before. It's called the multilingual, multimodal, and multi-attribute model, or like M3 for short. From the name, it's a multimodal input. So it takes in things such as like the profile image. I think it uses DenseNet. And then it takes in like the textual input, such as like username, screen name, and like biography. The architecture, I think, is also in our paper as well. But basically, it outputs things such as like age, gender, if it's an organization or not, based on like the profile image and just basically all the textual input that we have available from the metadata from the Twitter users. So age, gender, that's how we got it. And organization or not kind of helps us determine if it's like a bot or not, because a lot of times we catch different, I guess there are a lot of bots that kind of occur on Twitter that we might have caught. So that's kind of how we use it as well to kind of filter them out.
Maybe I'll talk a little bit about how we did political affiliation. In Professor Lo's group, in one of their previous works, they found that most people, if they follow a political candidate on Twitter of a certain party, there's 92% chance that they'd only follow people of that party. So for example, if someone follows, like, let's say a Republican senator, then there's 92% chance that they only follow Republicans. And with this fact in mind, we can use this as a pretty good heuristic for determining whether someone is affiliated with any political party, right? Because we can just look at who are you following, take a list, a dictionary of the Republican senators, all the Democratic senators, all the Democratic House representatives, and if someone's following them, then most likely they're one party. And then we can say that this person is Republican or Democrat.
Oh, that's very interesting. Yeah, I mean, some people might put it in their profile, but I wouldn't take that for granted. And I guess personally, I would hope people would follow a variety of candidates from all the parties or both parties. But if that's not happening, you guys have a great feature available to you. Thanks to this week's sponsor, Brilliant. This week I want to tell you about Brilliant's group theory course. I got to group theory a little late in my studies, but I'm glad I did. It helped me out a lot with my object-oriented design, or maybe it made it more complicated. Either way, really enjoyed the subject, and I can't think of a better way to get into it than the group theory course at Brilliant. It will introduce you to some very fundamental topics in mathematics and help you better understand things you thought you already understood. Group theory has a very gentle introduction, starting out learning about symmetries and some of the basic principles and building blocks for this mathematics. Like all Brilliant courses, it's wonderfully visual and broken up into bite-sized chunks for learning. If you're looking for something arguably more practical, visit the statistics and probability section and look at the courses they have available there. As far as I'm concerned, these are really all required for any decent data analyst or especially a data scientist. Whether you're learning for the first time or need a quick review, Brilliant is a great tool to help get you deep into a subject in a way that's understandable and fun to learn. Head over to brilliant.org/dataskeptic so they know we sent you. You even get a nice discount. Brilliant.org/dataskeptic.
It's actually true. I think this country is highly polarized, that each side cannot tolerate the other side. Okay, maybe you can tolerate one or two tweets from the other one, but to have tweets from party you don't like constantly coming to you, that's hard to imagine.
Right. And also previous demographic analysis on Twitter users have shown that the population on Twitter is actually highly non-uniform in the sense that certain demographics are more present on Twitter than you would expect when compared to census data. So for example, Twitter skews Caucasian, male, and politically liberal, or Democrat, I guess. And this was based off a study done in 2010. I guess I'm kind of returning to a question. I think, Kyle, originally you asked us what was a sort of impetus for deciding on this topic specifically. And I think one thing that I did not mention was the sort of brief timeline about the United States official governmental policies towards face mask usage. So basically, back in, I believe, February, the United States Surgeon General tweeted that masks are not needed. The reason why he did this, according to consensus at that sort of time, was that there's worries that hoarders would try to buy up all the surgical masks as a form of sort of price gouging if the United States health officials said that, masks were effective and whatnot. Because at that time, technically the scientific literature, actually, I'm not completely sure about this, but they were claiming that they didn't know whether masks helped or not to effective extent. And so that was the initial stance. However, in April, the CDC announced that they actually did recommend face cloth. And then after that, the Surgeon General tweeted back in June, actually, that, masks are cool now. Everyone wear masks and stuff. And then also the other big event, I guess, would be in July. Beforehand, Trump had said, masks are not for me, was one of his sayings. But after that, he tweeted a tweet of him wearing a mask. We are united in our effort to defeat the invisible Chinese virus. And many people say that it's patriotic to wear a face mask when you can't socially distance. There's nobody more patriotic than me, your favorite president. So as you can see, there's sort of this bing bong back and forth between whether face masks are effective and whether face masks are not. This sort of degrades trust in sort of governmental institutions. And so we're interested in discovering what effect do these political shifts or these policy shifts on face masks have on people, on what type of people, like different demographics of people? And what effect does it have on their attitudes towards face masks? So that's one of the primary motivating questions of this paper.
Yeah, good point. I think I'm going to work my way into some more details on that, but I want to do a few more preliminary questions before we get to it. First and foremost, I guess I'd love to get your guys' thoughts on how something about the precision or the accuracy of your methods of deriving demographic data. Of course, it's not a firm field. We don't have a ground truth here, so you can't exactly know. Although when you tell me something like, 92% of people follow only one party, well, it seems pretty obvious what party they're with. But broadly speaking, do you have a sense, certainly the approaches must make a mistake here and there. How accurate are your methods of inferencing, or do you even have a way of getting to some sense of how accurate the methods are?
I think the accuracy varies depending on what demographics we are talking about. So for gender, I think it's highly accurate. It's definitely in the 90% range. Age, in general, I think the algorithm can be within like plus minus 10 years. These are evaluated on independent data sets. So based on our past experience, if we have large scale data and if any one of our predictors or classifiers is better than 80% accuracy, then generally we can trust the results that are produced based on such inferred demographics. So yeah, I don't remember the exact data, but I definitely remember the one for gender. Age, I think it's within something like 10 years, plus minus 10 years old.
Right. So the classifiers and inference vary in terms of accuracy. Some of them have been tested on sort of ground truth data sets. So they've been trained on ground truth data sets. So we can, get a feel for the accuracy there. And then afterwards, we can run it on the Twitter data. As Kyle mentioned, we don't have ground truth for that, right? And we also do our best to try to reduce noise within the Twitter data set. For example, I'm attempting to remove bots and looking for in that sense. But I think the best answer I have for you is that for some demographics, without ground truth data, this is using our heuristics and our methods are the best approaches. They're basically the only approaches, because Twitter, of course, will not give us ground truth data about their users. And I think Professor Lo also made a good point in the sense that even if there is sort of fluctuations in accuracy, as long as it's within an acceptable degree and you basically have a lot of data, like a ton of data, we can still make substantive claims about sort of demographics because we have so much data and because the accuracy is within a reasonable error range. And again, for more details on this, you can look at the paper. And of course, again, we recognize that some of the methods are based off heuristics and based off of very strong assumptions. But without ground truth data, a lot of times this is the best you can do. For example, I believe Professor Lo, we were talking about this the other day about a paper in Nature that used mobility data to basically analyze COVID-19. And basically, one of the ways they made claims about how certain demographics are faring better or worse in COVID is by looking at the location and then using census data and basically saying, okay, census data says this zip code 12345 is 40% Black, 30% white, et cetera, et cetera, et cetera. And also the average household income for this zip code is X. And with this, we can say anyone who comes from this area is going to just have an income of X. We assume that because that's the average household income. And again, because there's not necessarily a better way to do it. No one has really the income data of the users, but it's still a very important demographic to look at.
I was just going to add that these methods, if they are reliable enough, they can give us ballpark ideas of what's going on. Even not precise at the individual level, but at group level, we get the ballpark ideas.
Yeah, good point. So then you have all these tweets, and they've been presumably labeled with all this rich demographic data you guys have been able to inference or derive. Then you're left with some nice labels attached to what is more or less free text. Where do we go next?
So one thing we want to kind of do is we wanted to see how different demographics feel about face masks in general. Like you said, we have all these tweets for each demographic, but it's just text right now. So the next thing we kind of did was sentiment analysis. So after cleaning the text earlier that we talked about, we just went and used sentiment analysis. I think we used a balance-of-word dictionary and sentiment reasoner. It's actually really helpful for sentiment analysis for social media data in general because it takes account things like emojis. They kind of reveal a lot about the sentiment of a sentence and things like that. And we kind of just use this to classify them as neutral, positive, or negative based on a standardized score that the sentiment produces. And then from there, we just kind of drew analysis. We did some topical analysis as well.
Right. Just speaking a little bit more about the topic modeling. So basically, we produce embeddings from the tweets and run latent Dirichlet analysis, LDA, and produce a topic model. And basically, the idea is we find this sort of clusterings of the texts, and they cluster together in distinct topics. And we found 4 topics, which are pretty interesting. So as a note, when we run LDA on tweets, it only tells us that tweet 1, 2, and let's say are part of this topic, and tweet 4, 5, 7, 8 are that topic. It doesn't tell us what this topic is exactly. We need to interpret it subjectively by basically reading what sort of tweets are there. But the clustering is pretty, I guess, quantitative. So the 4 topics that we have are, first topic is basically masks at school and work. If you look at the paper, there's a table, an example tweet, in the topic description. The first topic talks about masks at schools and work. Here's an example tweet, right? No requirements appear to be included for masks or any other additional safety and prevention. When the majority of teachers and support staff are homesick, that'll be a short school year. This one's talking a little bit about, observations about mask usages at schools and work. A lot of them are like, oh, there's like no one wearing a mask around me. I'm very afraid. Or why are they telling us teachers to come back to school? This is a death sentence, et cetera, et cetera. The second topic is about governmental mask policies. This can be talking about your state representative or your senator and what their stances are. And usually it'll either be applauding their sort of stance on them, on the masks, or it will be berating them, saying things like, oh, lives before politics, governor. And then I applaud, this governor for wearing masks, or I applaud this governor for standing up to the haters or whatever and not wearing a mask. So it goes back and forth, but those are the sort of governmental mask policy topics. The third topic talks about post-pandemic events. And this is one that I found very interesting. Basically, a lot of these tweets are very future or forward-looking. And they talk about, like, here's an example tweet. Wear a dang mask if you want to see big techs again. So I don't know what big techs is exactly. It could be a college or something. But the idea is they're asking people to wear masks so we can get to, a normal state again. So I can do X, so I can go to concerts. And the fourth topic is just general public health concerns. And here we see still like ongoing debates about sort of the efficacy or efficiency of masks. And then also, like, for example, for the example tweet talks about, it's a quote from a doctor. The doctor says, from a medical standpoint, it would be extremely rare to have a condition where you truly could not wear a mask. And this is still a hotly debated issue. This is not a claim, actually. This is true. But certain individuals are extremely sensitive to things touching them or things on their face. The official sort of health condition is escaping my mind right now. But basically, people are still claiming, and people are claiming falsely that they have this condition as an excuse to sort of not wear masks. And so I guess that would be fitting within the topic 4.
Yeah, so those 4 topics make very intuitive sense to me that I'm not surprised those would emerge out of the data. What do you do next to slice and dice? How can we learn something interesting about how the different demographic groups respond to each of those?
So, at this point, we just basically have like a huge, I guess you could say like a database of just like all the tweets along with the demographics and things like that. So we're able to look at them like individually, or what the sentiment or what the topics are for like just women, males, less than 18, college students or whatever. So that's kind of where we went from here.
And what are some of the most, I guess, pronounced differences? Are men different from women? Are age groups different? Where do you see things surprisingly discontinuous, I guess?
So some interesting things we kind of see is that Republicans in general they have a more negative sentiment toward masks in general than Democrats. That we don't know really why, but we can infer some things. And then, for example, things such as like for locations, we see that West Coast and East Coast, they have a much higher sentiment as opposed to like the counterparts in like the Midwest, South, and like rural areas. We also see males are actually much more negative when it comes to, I think, about college masks, both in like college and non-college, but also general population as well.
There's one I want to add, that's in terms of ethnicity categories. So out of a number of major ethnic groups, European ethnic group is the only one with pronounced negative sentiment towards face masks, while other groups like African American, Hispanic, East Asian, Indian, they all show positive sentiment towards face mask wearing.
Yeah, I guess I'd also like to mention that whenever we could, we would use existing surveys that are out there and compare them against our findings. For example, the fact that males have a lower sentiment towards face masks and that males are less likely, and then we can infer that males are less likely to wear face masks from this. This has been confirmed by a New York Times survey. And we basically compare against a survey as a sanity check to make sure that our inferences are getting similar results. Now, from the existing survey data, any inferences that we made compared to existing survey data did not clash necessarily. So that is, any demographics that the survey data looked at, we could draw similar conclusions for the demographics that survey data did cover. We couldn't find any survey data about some demographics like income, but those we could basically use previous literature, which used non-survey-based approaches, but also found like similar disparities within people of different income levels. And also just, I guess, elaborating a little bit more about why, like speculating a little bit about why some of these demographics sentiments came out the way they did. For example, coastal and metro areas had higher sentiment scores. Now, one natural way to think about this could be in cities, typically they're more population dense. And if they're more population dense, then it becomes more pertinent to wear face masks in general because you're closer to people most of the time. And so if you're in a rural area, you wouldn't really necessarily need masks. And so you might not have such a great view. And some of these demographics, interestingly, are also correlated. So for example, I don't need to cite anything. This is general knowledge that coastal areas lean blue. And so it makes sense that, let's say, if coastal areas have positive sentiment, then it also makes sense that Democrats are more likely to have higher sentiment as well. And so those are like little sanity checks we can interdisperse between our analysis. And of course, this is just speculation based off of, or not speculation, but these are informed sort of analyses. But we don't really, of course, know the reasons why this could be. But we do have this data, and we can say that this demographic has higher or has lower average sentiment.
Also, just in general for the sanity check, just kind of goes back to like accuracy of our things. We kind of had a lot of sanity checks built in as well. Like, for example, we looked at what's the average age of like, or what majority of college students are like this age. And that kind of matches up with like our results. For example, like a majority of people we've classified as college students are like less than 18 or 18 or between the ages of like 19 to 29, which are kind of like the standard age, what you expect a college student to be.
I was just going to add a perspective on how we look at these things. So in general, when we discover some insights or findings and we get confirmation from other social science studies, that serves as a sanity check, as Neil has mentioned. But even in that case, I think our type of approach offers something extra. In other words, we can confirm some common belief, say Democrats are more positive towards face masking. However, with this type of large-scale data analysis, we actually provide extra quantitative confirmation. In other words, we may know that's the case, but we don't know to what degree that's the case. That's something we can offer with large-scale social media data analysis. So that's one side of the coin. The other side of the coin is when we discover something that cannot be confirmed or were not discovered by other studies, these are new insights. But if we want, we can take this new finding and design surveys and questionnaires to confirm them. So that's the added value of this type of approach. We can confirm common beliefs, but with degrees and extent information. So it's quantitative. We can also discover new things that can be confirmed, which would provide further understanding of the social events and what have you.
Thanks to this week's sponsor, Springboard School of Data. Did you know data science is a fast-growing career field with 650% growth in jobs since 2012 and a median salary of $125K? Springboard has identified that data careers are going to shape the future and has responded to that need by creating the Springboard School of Data, a comprehensive end-to-end data career program that encompasses data science, data analytics, data engineering, and machine learning. Each Springboard course is 100% online and remote, and each course curriculum is tailored to fit the schedule of working professionals. Every Springboard student graduates with a portfolio of projects to showcase their skills to potential employees. All of Springboard's data courses are supported by a vast network of industry expert mentors. Springboard's tuition-back guarantee allows students to secure the role of their dreams and invest in themselves without risk. Want to learn more? Springboard is exclusively offering up to 20 scholarships of $500 to listeners of Data Skeptic. Simply go to springboard.com/dataskeptic for more information. So doing even just the baseline of where we've talked about so far of attaching demographic data and doing some slicing and dicing is very informative. It can teach us something about how different groups perceive public health issues around masks. But I know you guys took this even a step further and did a few experiments around how different demographics responded to news events. Could you talk a little bit about that?
Right. As I originally mentioned, these policy shifts were one of the original reasons why we were so motivated by this topic, because inconsistent messaging can degrade sort of trust in public health institutions and government in general. As we can tell through sort of just being on social media in 2020, go anywhere and you'll find inconsistent messaging about a bunch of things, right? And sort of social media has been shown to distort the messaging behind many other health related things like vaccinations or whether the earth is round. These things are conspiracies, but that have become more mainstream due to social media. But yeah, sorry, that was a little tangent, but basically the way we can measure the sort of effects of news events is we can say, okay, up to this point in time, we had a sort of mean or a variance of our sentiment of some value. But then after this point, the mean or variance shifted significantly when we look at the time series. And so basically, this is a technique called change point detection. And so the idea is given a time series, we find a time when a measure that we choose, whether that be mean or variance of the time series, statistically changes significantly. There's two types. There's offline and online. And so online change point detection assumes that you have no access to the full time series data. So this could mean you're streaming it, for example, while offline change point detection assumes that you have full access to the time series. And so we used offline change point detection here. There's been previous works that have used online change point detection among Twitter data, but the goal of that study was slightly different from ours. We look at each of these time series, these sentiment time series, filtered by demographics. So we look at the Republican time series, we look at the Democrat time series, we look at the high income time series, we look at the average income or medium income time series, et cetera, et cetera. And basically we look and see, can we discover any sort of change points? And if we discover a change point, basically it'll be like day 0 or day 1 or 4 days away from, and we started our earliest date is around January 7th. And we'll say like, oh, it's X days away from January 7th. Okay, now I'm going to look at the news and then I'm going to assume that anything that happened in the news that day is most likely responsible for that shift. Now, this is a very strong assumption, right? Because it could be that this shift that we see, the statistically significant shift, is caused by some other event, right? But I think we can say that we can largely correlate the two because, first off, mass in general, just according to the news and other papers, the perception has been affected largely by what are the stances of the government, what are the stances of the public health officials. And then usually during that day, our existing data set is already mining for mask-related stuff. So any mask-related news is most likely causing this shift. And so with that thought, basically try to identify those change points so that we can say something about how certain demographics react to these statistically significant events. And again, this is statistically significant. So it's not like I'm looking at the time graph and subjectively we're doing certain calculations to ensure that this is a statistically significant shift. And so we found something very interesting. So first off, we could not find any change points for when we filter by any demographic except political affiliation. We found that for Republicans, there's only change points present when we look at the Republican sentiment time graph and the Democratic sentiment time graph. And basically, the two events, miraculously actually, correlate with two large policy events. So the first one is the CDC change on face mask stance, which was April 3rd. And the second one was June 20th when Trump wore a mask. And so the reactions of the sentiment were kind of made sense, I think, intuitively. So on April 3rd, when the CDC said, okay, we should wear masks now, Democratic sentiment went up while Republican sentiment went down. And then for when Trump wore a mask, Democratic sentiment, interestingly enough, went down, but Republican sentiment went up. And so you can see if our thesis is that America is polarized, there we go, right? Like there's nothing clearer than other party donning a mask and your sentiment towards masks going down. But again, this is not saying like it went down a ton immediately after. What it's saying is if we look at the time series graph up to that point, the variance was this, but the variance significantly lowered when we look at the time series past this point. I just want to make sure that's clear.
It's surprising the Democrats' response would go negative, although maybe they're tweeting, I hate this man, but at least he's wearing a mask, right? That could be something a Democrat might tweet, and that would have a negative sentiment, but it would probably be for a day or two. Do you see something that's a blip, or do you see really like a longitudinal change?
I think I would characterize change point detection as longitudinal. Let's say there's a time series and there's only one change point, but we don't know where it is yet. The change point is defined as the place where we slice it in half, where the first half has some variance, but the second half has a variance. And again, variance would be taking over the aggregate over that half is significantly different. So I think we can characterize it as a longitudinal, as in after this point, Democratic sentiment was statistically significantly lower. And again, we can speculate that this might have been caused, at least in part, by this event, right? Because if we're detecting a change point at that time, that's saying like after this point, statistically, the variance is lower. Now, what that could mean in terms of like why Democrats' reactions were like this, we can only have a reasoned guess. But yeah, isn't that weird though? I find it very strange as well, or interesting at least.
Well, to wrap up, I'm curious to get all of your thoughts on maybe next steps and also who you hope might be influenced by your work here. The analytics and the data alone are novel and interesting and certainly worth study, but perhaps if someone could read this and find insight and take a positive action for the benefit of all, what might that be?
So I think that in general, if we know how certain demographics kind of respond or feel about certain face masks, public policies, or because face masks are effective, so they could target those groups, maybe make them feel better about face masks, make them more likely to wear face masks, kind of reduce the spread of the coronavirus in case, it doesn't go away anytime soon. We can have lower transmission rates and that kind of stuff.
Let's first restrict our discussion to face masks. I think there are a number of ways we can use the findings of our research. One is for the groups that are resistant to face mask wearing, just as we discover this time series analysis, maybe we can convince some influential, say, Republican political figures to promote face mask wearing. Maybe that would bring more Republicans in line to wear face masks. And another thing I'm doing with other researchers at different colleges is we're trying to understand why some people are resistant to face masks, whether, it's hard for breathing or it affects face-to-face interaction. There are quite a number of reasons that have been reported through surveys. So maybe if we design different masks you can see through, then more people will be more inclined to wear face masks. So that's as far as face mask wearing is concerned. We are also doing some research to understand people's public opinions on vaccines, because vaccines are coming. So initially, I think in spring, the survey found like 75% people are in favor of taking vaccines if they are available. But then vaccine also became a polarizing issue. So by the time of election, I think only 50% of the population are willing to take vaccines if they are available. So that's another phenomenon we are studying. We are studying that as well. We're also studying, hoarding behaviors. Now that we are in this third wave, I think hoarding is picking up again. So we did some study on the first wave. So we want to understand, why people hoard and what can we do to prevent people from hoarding critical resources. So overall, we hope this line of research, we're not saying this would completely replace poll or survey-based social studies, but I think we believe social media-based data analysis can offer something complementary and different. So that's where I see how this line of research could go in the near future.
I think what our demographic analysis offers is the idea that messaging needs to be sort of tailored to certain demographics. And I think Professor Lo put it very well, mentioned this point as well, right? So if we know that this group X has intrinsically negative sentiment, then we can study this group specifically and say like, oh, okay, what sort of messaging would go better? And this has been done, I think, for social distancing protocols. And they found that like certain people respond better. For example, when you present public health precautions as an economic issue, you say like, oh, this will cost X amount in GDP, or we all want businesses to open up again, et cetera, et cetera, et cetera. And I think these are strategies people are using now. But with our approach, we're able to look at this really in a large scale setting that's not confined to artificial survey-based setting. And as Professor Lo mentioned, surveys have many problems. And I think one of the specific bias issues is how questions are presented. Because inherently, when we hear a question, we immediately have thoughts associated with that. Okay, that's not a good way to put it. But what I'm saying is the wording of a question can have the effect of an answer of a question. But in our case, we're looking at what is there, what is being said without us even prompting someone or even priming someone with a question. And in that sense, I think our insights are very valuable. In terms of future work, I think this is a great topic, or COVID-19 still has a lot to learn about COVID-19 in general and different aspects of COVID-19. Specifically for our work, I think Jonathan and I talked about this a little bit. And then if we did extend this work, there'd probably be some additional accuracy things we would probably do, maybe like better screening for bots, things like that. But yeah, in terms of other work, so we're very, very interested in continuing to look at COVID-19 and vaccines. It's nice that we look at these issues that are very unique to the internet age, in the sense that they would not have emerged without the internet, without social media, and look at them using methods that understand social media, using sentiment analysis that understands emojis, for example, or using topic modeling, these things. Yeah, so I guess future directions, we got to see what other subtopics that we can look at for COVID-19. Because again, I thought, COVID-19 would be over, but clearly it's gone on a lot longer than people have expected. So it's still a very rich subject to study.
And I would also add what we learn and study from COVID-19 will have far-reaching impact on future pandemics, not just this particular one. We hope we learn enough that can reduce the negative effects when the next one comes.
To wrap up, do you guys want to share a Twitter handle or a URL to a blog or anything like that if people want to follow up with you or this work in the future?
Even though I have been doing Twitter-related research for so many years, I don't have a Twitter handle.
I actually don't have a Twitter as well. I don't use it.
I'm embarrassed to say that my Twitter is not very active. But I think emailing any of us would work. Our email is on the paper itself. My school email is here if anyone wants to contact me.
You can easily find my homepage by Google my full name, Jiebo Luo. I think there's a link from my homepage to the department homepage.
Well, I'll have that in the show notes so people can follow up there. Awesome. Well, thank you all again for coming on to share this work. It was really interesting stuff. That concludes this installment of Data Skeptic Consensus. Our guests today were Neil Jung, Jonathan Lai, and Jiebo Luo. Our theme song is Paradox by Odling. Claudia Armbruster is our associate producer. Vanessa Burciaga does guest coordination. And I've been your host, Kyle Polich.